All right, I think people are starting to come in. We're going to give it just a minute and let everyone join us, and then we will get started with this month's webinar. Okay. Welcome everyone to PK University. My name is Catherine Warren, and I am the Executive Director of the National PKU Alliance. We're really excited for this month's webinar, which is made possible by our friends at BioMarin. And I'm actually excited to be joining the BioMarin team here in San Rafael, California. We have a big event that we're doing tomorrow as part of PKU Awareness Month and our Move Your Feet initiative. So the BioMarin team is doing a big walk here. So we thought what better time to do the webinar. So we're really excited for today, especially as we recognize the opportunity that was made possible by the expansion of PALYNZIQ to include teens ages 12 and older. This represents an important milestone for the PKU community and opens up new treatment possibilities for adolescents and their families. So today we have a great lineup for you. We have Stacia and Cruz, along with Dr. Missy Tharp and Dr. Kristen Lindstrom. To begin the program, what we're going to do is we're going to start with Dr. Tharp, who is going to walk us through the safety and the efficacy data for PALYNZIQ in both teens and adults. We also, as I mentioned, have Dr. Lindstrom, who is a medical director with BioMarin, who will be available for Q&A as well. And then after Dr. Tharp's presentation, we're going to hear from Stacia and Cruz. And together they're going to share their personal experience navigating PKU as a family and what it's been like managing treatment through the teen years. So Stacia and Cruz, thank you all so much for joining and being willing to share your personal stories. And then before we get started, just a little bit of housekeeping. For those attending, your lines are going to be muted during the presentation. But we really encourage you, if you have questions that you'd like to ask, to utilize the Q&A box at the bottom of your screen. Kelsey McQueen, who is the NPKUA Associate Director of Research Development, will be moderating or monitoring the Q&A. And questions will be addressed throughout the program and again at the end. So at this time, I'd love to introduce the BioMarin speaker, Dr. Missy Tharp. Michelle, who goes by Missy, is a metabolic genetics nurse practitioner at the University of Mississippi Medical Center in Jackson, where she manages the metabolic genetics and newborn screening clinic, metabolic inpatient care, and metabolic consult service. So with that, Missy, I will hand it over to you.
Thank you, Catherine. I really appreciate the introduction. I'm really excited to be here tonight. Like Catherine said, I have been in metabolic genetics for a little over 10 years now. I treat many different metabolic conditions, but PKU is by far my favorite population to work with. I really like the relationships I build with my families who have a PKU loved one. And I like that we have some close communication, and I feel like we really grow to have this great relationship. Probably a lot closer than I should at times. I feel like they become part of my families. So let's get started. Today we're going to talk about PALYNZIQ. And so, as many of you have heard, that PALYNZIQ is a prescription medicine that's used to lower those blood Phe levels in people who are 12 and older who have PKU, whose Phe levels are above the 600 micromoles per liter or 10 milligrams per deciliter on their current treatment. If you're interested in PALYNZIQ, you should always discuss the benefits and the risk with your healthcare provider, your clinic team. One thing that's important to know about PALYNZIQ is that it can cause a severe allergic reaction or anaphylaxis that can be life-threatening. It can happen at any time during treatment. It's important to recognize the signs and symptoms of anaphylaxis, and we're going to talk about these more during today's presentation. Of course, if you have any of those concerns of anaphylaxis, then you should stop the treatment immediately and seek some medical help. And we can go to the next slide. This presentation is sponsored by BioMarin Pharmaceuticals, and I'm being compensated for my time here today, and I have no other disclosures. And on to the next slide. All right. So PALYNZIQ is the first and only PKU treatment that's proven to lower Phe levels without requiring a restricted diet. And I know that is a huge last part of that sentence. The restricted diet is the big part that everybody says, wow, that's really important. In clinical trials, there were really significant results for both adults and teens. 2 out of 3 adults had a Phe level of 6 or less at 2 years. And now for the ongoing study that's going to interest a lot of you, and it's broadened that indication for PALYNZIQ for 12 and older. Teens' Phe levels were cut nearly in half, with an average decrease of about 8 milligrams per deciliter at 17 months. And we can move on to the next slide. So lowering Phe, we all know, is so important because those high Phe levels can really affect how you think and how you feel. For adults, you're balancing family, you've got kids, a spouse, maybe parents you're taking care of, you've got work you're trying to balance, you've got your friends you're trying to make times for, and it's so hard to follow that Phe restricted or protein restricted diet. Really, 9 out of 10 adults struggle to keep their Phe levels low with diet alone. And when those Phe levels are higher than they should be, when they increase, it leads to so many symptoms. And you see a summary of these symptoms listed on this slide, and you probably have experienced some of these. Brain fog, irritability, anxiety, and depression are just a few. We can go to the next slide. So looking at this slide, we're talking about moving into those teenage years. In my clinic, I see all the time when children are becoming more independent and growing into those teen years, this is when they really start to struggle with their Phe levels. 50% of teens age 12 to 14, so that younger group, they really report starting to struggle with that diet. And by the time those kids are 15 to 19 years old, 80% are struggling with keeping their Phe level down with diet. So these challenges not only affect the person with PKU, but they affect the whole family, the caregivers, everyone who's involved in that teenager's life. And similar to adults, teenagers with high Phe levels really see an impact on, they have many symptoms. It can affect their emotional regulation. We see problems with self-confidence and connection with peers, and that's just a few that we can see with teenagers. And overall, managing PKU, we don't want it to feel like a burden on the family. Those effects of high Phe can build up over time, and that's why it's so important to find an option that can really lower those Phe levels and help the whole family, not just the person with PKU, and achieve that diet flexibility that so many people want. We can go to the next slide. So on the next 2 slides, we're going to look at how PALYNZIQ works and how it's different from other medications. So when we're looking at the slide, we need to have a little bit of background. So Phe is broken down by an enzyme called phenylalanine hydroxylase, or PAH. People that don't have PKU, they have enough of this phenylalanine hydroxylase enzyme to break down Phe, and it doesn't build up. It causes no harm. So then you think about people with PKU. Their PAH enzyme either isn't working properly or there's not enough of it. And so Phe then builds up in the blood and can cause harm to the brain. These 3 pictures on this slide show us how PALYNZIQ works. In the first picture, you see the PAH enzyme in the dark blue. There's just one dot of it, meaning there's not a lot of that enzyme there. And so you see the Phe around it in purple. In the second picture, PALYNZIQ is the green I'm not sure what that shape is, the green one. And it is an enzyme substitution therapy for PKU. So what this means is that it really addresses the core of PKU by substituting for that enzyme that's either missing or not working properly. And then in the third picture, you see the PALYNZIQ is able to break down the Phe to lower those levels regardless of how much enzyme is there or how much is working. And that's why it's been shown to work across all PKU types, whether it's classic or non-classic PKU. Oops, sorry. And we can go to the next slide. Let me get mine. Okay, there we go. So oral medications work differently than PALYNZIQ. Oral medications help to make that PAH enzyme work better. So if you don't have enough of it and it's not working properly, there's still a chance that those oral medications are not going to work for all people, especially people that have that classic PKU. And even if they do work and they help some, they usually still require a restricted diet. And we can, perfect. So PALYNZIQ has been studied for nearly 2 decades. It's proven to be safe. It's effective across all ages from 12 and older. And it's also safe and effective in all PKU types. So PALYNZIQ was studied over time. It's been studied on adults who have Phe levels from 10 to 38. Teenagers 12 to 17, they have Phe levels from 10 to 26. And it's also been studied on unrestricted diets. In fact, more than 84% of adults were not on a Phe restricted diet, and 53% of teens were not on a Phe restricted diet. We can go to the next slide. There you go. So let's look at these results over time now. We were talking a little bit about adults earlier. Let's look at how long it takes to get a Phe level of 6 or less. So in the adult studies, 3 out of 4 people were able to reach a Phe level of 6 milligrams per deciliter or lower. 25% of people reached this Phe level by 6 months. 50% reached this Phe level by 10 months. And 75% reached this Phe level by 16 months. And we can go to the next slide. So most people on PALYNZIQ, this is really important, were able to reach a Phe level similar to people who don't have PKU. People without PKU have Phe levels from 0.5 to 2 milligrams per deciliter. And 118 people that were taking the PALYNZIQ, more than 2 out of 3 were able to reach that Phe level below or equal to 2. So if you were to take PALYNZIQ and reach a Phe level of less than 0.5, that's called hypophe. If that happens, you're going to discuss the level with your clinic team, and they might change your dose of PALYNZIQ or modify your diet some. And we can go to the next slide. Good. Now let's talk about the ongoing study with teens. How long does it take for teens to reach a Phe level of 6 or less? These results are very similar to the adults. More than 5 out of 5 teens, I'm so sorry about my dog. More than 5 out of 10 teens had at least one Phe level below or equal to 6 milligrams per deciliter. So 25% reached this Phe level by 7 months, 50% were able to reach this level by 10 months, and 75% reached this Phe level by 15 months. And again, this really shows that sticking to PALYNZIQ can help people reach their treatment goals. Now, Similar to adults, about half of teens were also able to reach those Phe levels of 2 or less, which is that same level of people who don't have PKU. What this shows us is once this PALYNZIQ starts to work, the results continue. Once a person is able to achieve 10 milligrams or less, it's very likely he or she is going to be able to reach a level of 2 or less. So once we see Phe lowering, we're going to most likely see those results continue. All right, now let's talk about diet, specifically in adults in one study. A common question that we get in our clinic is, do I have to be on a protein or a Phe-restricted diet in order to start PALYNZIQ? 84% of people were not on a Phe-restricted diet before starting PALYNZIQ. 94% were not on a Phe-restricted diet at the last assessment at the end of the study.
And I'm going to jump in here because we're starting to get some questions from the audience. If we can take a quick break for some questions.
Okay.
So one we actually had, I think you were talking about this from a couple slides ago, but if Kuvan doesn't work for me, will PALYNZIQ?
So Kuvan and PALYNZIQ work differently, and there's no way to know 100% if PALYNZIQ will work for you. Kuvan is the oral medication that helps that enzyme work better, and PALYNZIQ is the enzyme substitution medication. So it doesn't matter how much enzyme that you have or how much is working, it substitutes for that enzyme.
Okay, well, thank you for that explanation.
Yeah.
And related to diet, do you stay on diet or formula when you're taking PALYNZIQ?
So the important thing about diet is when you start PALYNZIQ, you're going to stick to the current plan that you're on. If you're taking formula, if you're on a diet, you're going to stick to that and talk to your clinic team about it. When you're on PALYNZIQ, they're going to monitor your Phe levels regularly, and that will be how they base those changes off of your Phe levels. And so everything should stay the same until you talk to your clinic team and adjust with them.
Okay, well, thank you. And how long will it take PALYNZIQ to work?
So this is very individualized. It's different for every person, and it's definitely a discussion with your team about how long you should try it. So we have data that shows about 50% of people who take PALYNZIQ have a Phe of 6 or less at 10 months. So, I mean, you think that is really close to a year. That's 50%. There's a 50% chance you don't have that level. So I would say at least a year. But again, that's something that you need to talk to your clinic team about, because definitely if you're willing to give it a shot longer, there's still a chance that you may respond.
Okay, great. And I think that answered so far the questions we've gotten, so I'll let you get back to it.
Okay. Sounds good. And we are on. Yep, we just finished that. Okay, perfect. Give me 1 second. All right, so we have been talking a lot about PALYNZIQ and how it works, and now I want to transition to talking a little bit about safety. The first side effect we want to discuss is a severe allergic reaction called anaphylaxis. 1 in 10 adults and teens did have the severe allergic reaction. Now, what is really important that I want you to notice about this is that means that 90% of teens and adults did not have the severe allergic reaction. Everyone who did have a severe allergic reaction, they recovered and had no lasting problems. Your clinic team is going to talk to you about an epinephrine device that's going to be carried with you at all times. The bottom right portion of the slide has signs and symptoms of anaphylaxis, and your clinic team is going to go over all those with you. And there are other allergic reactions that can happen while you're taking PALYNZIQ, like itching or rash, and your team at your clinic will prescribe pre-medications to help reduce any of these symptoms. We can go to the next slide. So anaphylaxis with Palynziq is different than other types of allergic reactions. I'm sure that you all have heard of somebody with a peanut allergy, and they ate a peanut, they ate a whatever Reese's peanut butter cup, and their lips swelled up, their throat got tight, and they had to, call 911 or go to the emergency room, use an EpiPen, and they know now for the rest of their lives, if they get in contact with peanuts, they're going to have to use their EpiPen. They're going to have a reaction always. Palynziq is different than that. The allergic reaction with Palynziq doesn't, if you have it once, it doesn't always mean that it's going to happen again. You may still be able to take Palynziq. In fact, 72% of adults and 50% of teens who had the anaphylactic reaction were able to successfully continue treatment. There is a program called the Palynziq Risk Evaluation and Mitigation Strategy, or the REMS program for short. Your clinic team is going to talk to you all about that. And that is a program to make sure that you're fully informed and understand all the risk of anaphylaxis. We can go to the next slide. So anaphylaxis is not one of the most common reactions, but it's the most severe. Let's talk about what are some of the most common side effects of Palynziq. And so in adults, the three most common are injection site reactions, joint pain, and hypersensitivity reactions. The chart on the right shows that most patients experience the side effects while they're finding the right dose of Palynziq, and they're less frequent once they find the right dose. Most of these side effects were like mild or moderate, and they really decreased over time. And it is important to also note something here, that the frequency and the severity of the side effects did not go up when the dose of Palynziq went up. So it didn't matter if a person's on 20, 40, or 60 milligrams of Palynziq, that did not increase their side effects. We can go to the next slide. So how does this side effect profile compare to teenagers? It's very much similar. Teens had fewer side effects as time passed. The three most common for teens were similar to adults: injection site reactions and joint pains like the adults. And the third most common for teens was headache. We saw these side effects decrease over time, just like in adults. And really something that's nice to point out here on this slide is that less than 6% of teens taking Palynziq stopped due to those side effects. And that's because by the time the teen study came along, we had years of experience on how to manage these side effects, and we just got better at it. We got better at that, and we got better at adjusting doses. While we're on this slide, I want to mention injection site reactions as being the top side, or one of the most common side effects for adults and teens. And we have seen some serious injection site infections during treatment. And it's really important to remember to follow the directions that your clinic team give you for, washing your hands and cleaning the site. And also, you should change or rotate the sites that you're giving your injections. You should always be monitoring those for any redness or swelling or tenderness before you give your injections. And if there's any new signs and symptoms that appear, you can always talk to your healthcare team about it. Then we can go to the next slide. So this is looking at how do we actually give Palynziq. It is an injection that you take at home every day. The first injection you give yourself with a healthcare provider, and then after that you start injecting yourself at home once a week, and then you build up to daily. The needle for the Palynziq injection is really small. It's thin. It's just like a half of an inch long, and it goes right under the skin, so it's subcutaneous. It is way different than a flu shot that has a longer needle and goes into your muscle. It hurts way less.
And we'll jump in for another couple questions if that's okay. We got a few. Also, as a reminder, the Q&A box is down below, so please feel free to add any questions as we go through the presentation. But someone asked, does the research show if there is any significant difference in severity or chance of side effects based on age? So maybe like a younger patient versus an older one.
So no, the side effect and safety profile was very similar in adults and teens. Again, 1 out of 10 had an anaphylaxis reaction. That means 90% did not have that. And then those side effects for both age groups were very similar. And the side effects were maybe like better managed in teen study because we had learned so much about them. And there is definitely some pre-medications to help now, to give that help that now.
Great, thank you. And are there any long-term side effects with this drug?
So our side effects can happen at any time with this medication, but it's very variable. Some can be short-lived, some can be a little more involved. And the big thing I want you to remember about side effects is you really need to stay in close communication with your clinic team because they can help manage these side effects. They can help manage the severity or the duration of them. And it's real important, like we talked about just a second ago, to rotate those injection sites and use those clean techniques so that will help any skin-related infections. Palynziq has been studied in clinical trials for over 10 years, and there's ongoing long-term safety studies. They collect data through pharmacovigilance, and they look for any safety patterns, and they haven't seen any indication of any long-term side effects.
Great, well, thank you. That's all I've seen so far, so I'll let you get back to the presentation.
Okay, thank you. So on this next slide, it is a review of important safety information. And we've really talked about this, I feel like a lot, the potential for a severe allergic reaction and how to work with your clinic team. And we've also mentioned that REMS program to make sure you're fully informed about anaphylaxis. And we can go to the next one. So before you start Palynziq, there are a few important things that you need to discuss with your provider. We need to talk about all of the medicines that you're taking, including any prescriptions or over-the-counter medicines. We need to talk about vitamins and any supplements you may be taking. You also need to let your clinic know if you're unable or unwilling to use epinephrine in case of a severe allergic reaction. And then for women who are considering taking Palynziq, we need to let your clinic know if you're pregnant or if you're planning to become pregnant while you're on Palynziq. And the next slide. A few more important notes is we need to talk about blood Phe testing and diet, which we touched on earlier. Your blood Phe level is going to be managed pretty often while you're taking Palynziq, especially while you're looking for that right dose for you. And your diet should not be changed until you discuss with your clinic team. If you start Palynziq, you're going to stay on your current diet. You shouldn't change it. That will be changed based on those blood Phe levels. And then there also is a pregnancy surveillance program for any females who are taking Palynziq during pregnancy or who become pregnant while they're taking Palynziq. And we can go to the next slide. So to wrap up my portion of today's presentation on Palynziq, let's review why Palynziq is different from any other PKU medicine. So in the first picture, we talked about how it addresses the core of PKU by directly substituting for that PAH enzyme that's missing or not working properly. It lowers Phe levels below the expert recommended levels in both teens and adults. It does not require a restricted diet, and it's proven to be an effective long-term solution for lowering those Phe levels. Now I'm going to transition over to BioMarin to talk about the support that BioMarin offers.
Thank you so much, Missy. We appreciate your presentation. And my name's Quentin. I work on the PKU marketing team here at BioMarin, and thank you everybody for joining today. I just wanted to take a few minutes to take a closer look at some of the personalized support available for families and adults starting Palynziq. And once you decide that Palynziq is the right choice for you, there are a variety of tools and support options that BioMarin offers. So we just wanted to highlight a few of those today. I'll start on the left here with our Rare Connections Case Manager team. This is a team that provides personalized support for insurance coverage as well as financial needs at all steps of the treatment journey with PALYNZIQ. And in fact, this team, with the support of the Rare Connections case managers, more than 92% of patients have actually secured coverage for PALYNZIQ, and more than 97% of those with commercial insurance paid $0 out of pocket with our PALYNZIQ copay assistance program. So we wanted to highlight that. And then on the right side, we wanted to highlight a few of our other support options, which we're very proud to offer here at BioMarin. The first is our clinical coordinator team, and our clinical coordinator team are available to support you and your family with product education and support through all phases of the treatment journey, and they can meet you or your family in person, and also are available via phone or text. We also offer a PALYNZIQ Peer Connect program, which gives patients and or caregivers the opportunity to speak with others who have been down this journey before. And if you have questions or just want to get a different perspective, whether you're considering treatment or are on treatment, we have folks available. And then lastly, we do have the MyPal app, which is available for those starting treatment and on treatment to log their injections, to track their treatment, get reminders, and stay engaged with their treatment. So these are a few of our support options we wanted to highlight today. If you do have any questions with respect to coverage, feel free to visit the BioMarin Rare Connections website and get more information there. So with that, I'd like to go ahead and turn it back to the NPKUA team. And Kelsey, I don't know if we have any other questions for Missy that have come in, but we can certainly take those now. Thank you, everyone.
Yes, great. We have a couple more. So as a reminder, like we said, the Q&A box is down, but I have a couple flowing in. So the first one we got was, is PALYNZIQ proven safe and effective for mother and baby during pregnancy?
So there is a PALYNZIQ pregnancy program to collect data from pregnancies that occur while patients are taking PALYNZIQ. Kristen, do you have anything else to add to that?
Thanks, Missy. Yeah. So hi, I'm Kristen Lindstrom. I'm one of the medical directors working at BioMarin on the PKU program. And I can just add that, while we didn't study PALYNZIQ in pregnancy during the clinical trials, there have been cases of women getting pregnant on PALYNZIQ, who are being prescribed the therapy. And that's what that study that Missy just mentioned is for, is to be able to collect data on the outcomes of how moms and babies are doing. Because we have heard from clinics who have managed women during a pregnancy on PALYNZIQ that there have been babies born who are healthy. And we'd like to learn more about that and get more data to be able to share with you and the clinic. So that's something that is ongoing. But we have heard about this, we have seen this, and we're actively collecting the information now.
Great. Well, thank you both for that answer. Another question, is this an age-appropriate treatment for adults with PKU? For context, I'm 58 years old.
Absolutely, it is for sure. There is no age limit for PALYNZIQ. Like I said, the lower limit is 12, but absolutely for adults, whether you have been treated with other medications or tried other medications, whether you're on a diet or not on a diet, it's very appropriate for a 58-year-old to try to help lower those Phe levels.
Great. Well, thank you. Don't see any other.
We covered all the questions. So Missy, thank you again so much for your presentation. Kristen, thank you for joining in. And Kelsey, thanks for your help with the questions. Next up, we are going to spend some time talking with Stacia and Cruz. So if you all would like to come off camera for our conversation. There they are.
Hello.
Hi.
Welcome. So I'm gonna kind of chat with y'all for a little bit and just talk about the experience that y'all had. So, first off, if you would both tell us just a little bit about yourselves.
Sure. My name is Stacia. I'm Cruz's mom. I had Cruz in 2007. It was about 10 days before I turned 36. We have a super close relationship. I would say we're always challenging each other and trying to find things to laugh about. Our foundation of our relationship is respect. And kind of a cool little something is we named Cruz after the Santa Cruz Mountains, where his dad and I lived before we got married. I currently live about 20 minutes west of Minneapolis in a suburb named Orono. It's one of the suburbs that line Lake Minnetonka. It's so beautiful here. A few fun facts about myself is I taught yoga for over 20 years and I practice it every day. I'm a professional photographer and I spent a lot of time during Cruz's high school years photographing his hockey and all of his sports, golf. So I make jewelry and I work in the service industry as a supervisor at a cafe that serves organic food.
Yeah, and I'm 19 years old. My name is Cruz. I'm a freshman in college at the University of Tennessee, Knoxville, majoring in marketing. So go Vols. I'm huge into playing and watching sports, hockey, golf, and football specifically. During my time at Tennessee so far, I've joined a fraternity and have made a ton of lifelong friends. I'm also currently employed as a security guard at one of the bars in Knoxville while still holding a 3.85 GPA. But aside from that, my favorite part of the year is when summer comes around and I get to go back to Minneapolis and hang out with my high school buddies and enjoy the lake.
You can now say you're a sophomore at Tennessee, because you're home for summer, right?
That is true. Yes, I'll be a sophomore. I just got back yesterday from Tennessee, finished my freshman year.
Congrats on that, Cruz. Stacia, when Cruz was first diagnosed with PKU, how did your family react and what were your biggest concerns early on?
Cruz was a gift to my husband and I. We tried for almost 10 years to get pregnant. After all the struggles to conceive, I found out I was pregnant and it felt like our prayers were answered. Cruz was born a big baby and we had some complications at the hospital. The cord was wrapped around his neck twice, and so the oxygen levels were dropping while I was in labor. So once he was delivered, he was brought almost immediately to the NICU. They did let me hold him for about 30 seconds before they whisked him away. And my husband went down to the NICU, and the nurse said she had never seen such a big baby in an oxygen tent. He was 9 pounds, 3 ounces. So everyone's concern at that point was if Cruz's brain had received enough oxygen, and would his brain develop appropriately? So, and at the hospital, they couldn't really, answer that question for us. They said only time and observing, Cruz's development would give us the answer to that. So, but unbeknownst to us, that was the first of 2 concerning moments and events from Cruz's birth, after, that first week of life, because after Cruz was brought back into my room at the hospital, the nurse kept coming in to take his blood out of his little foot. And she came in not once, not twice, but 3 times, And I remember telling my husband, if they come in to take his blood again, I'm not going to let them. Why do they keep coming in to take his blood? So days later, I would find out the reason why they kept coming in to take his blood is because he was testing positive for PKU at the hospital, and they wanted to make sure the results were correct. So we just didn't know that at the time. So on day 4 of Cruz's life, we received a call from the hospital, and they said they were pretty confident that Cruz had PKU. And my heart just dropped. I remember, they told me it was a rare genetic disorder. They told me babies that are diagnosed with this weren't able to metabolize protein correctly. And, they wanted to run some more tests, so they wanted us to go down to the hospital to do that. So that was the beginning of taking, daily trips to the clinic for blood work, meetings with doctors, nurses, genetic counselors, dietitians for the first month of Cruz's life. The clinic asked, if we could continue with the normal feedings until he was 7 days old, because so I recall on that 7th day, Cruz slept a lot, and it's because his feed level was 21 milligrams per deciliter, and that was already affecting him. So on day 7, we began supplementing his milk with low protein formula. We put on brave faces, but we were lost. We were confused, didn't really understand how we were going to manage this rare diagnosis. Needless to say, we were frightened and we were worried and wondering if he would develop normally, both physically as well as mentally. And if he didn't develop correctly, was it the PKU or was it the lack of oxygen to his brain during birth? So the weight of all of that was kind of heavy.
Yeah, thank you for sharing that. But Stacia, my nephew also has PKU, and I remember that moment when my sister got the phone call. So thank you for sharing that. Cruz, we're going to turn to you. As you have gotten older, how did you come to understand your PKU diagnosis and what it meant for you?
Well, yeah, I remember when I was younger, I would always tell my friends and family that that it was an allergy. Like, I'm allergic to protein, is what I used to say. On my first day of kindergarten and all the way through my senior year of high school, I would have my own little bin where I could put my PKU formula, or as I call it, my protein shakes. My bin would be labeled with my name, and it started out in kindergarten kind of fun, like colorful, bold bubble letters, and later turned into more generic printed font. But my mom used to have to come in and actually present to my classmates early on about what I was doing in the corner when I would make my protein shakes, which I had to have in order to get big and strong. My parents made me feel like it wasn't even a chore. It was kind of like a responsibility that I had. Just like when I had to pee, I had to use the toilet or something similar to that. Almost like it was hardwired into my head. I understand that without it, I wouldn't be able to live out my dreams, which for me at the time was to actually play a professional sport. It could have been anything, hockey, golf, football, or anything else, honestly. I was always big into sports, and in order to live out my dreams, I needed to take my protein shakes. For me as a younger kid, it was nothing more than something I really needed to do, but that changed as I grew up. When I was about 12 years old, I think I started to think more about my future with PKU and what responsibilities I'd have, whether that was finding time to drink my shakes throughout the day, washing them in the dishwasher when I was done, or even how I would explain to my wife that I had to drink these shakes. At the time, I was drinking my protein shakes out of a Camelback water bottle. And as I got older, every once in a while, I would kind of get picked on a little bit. But I was lucky enough to have a good group of people around me to where it wouldn't happen all that often. But my main concerns of having PKU as I got older was really just contemplating how I was going to make my protein intake process more efficient. How I could do it where I can get the most protein while spending a limited amount of time worrying about it.
Okay. And Stacia, what did managing PKU look like for your family during Cruz's childhood? And how did it fit into school activities and daily routines for you?
Sure. You know, managing Cruz's diet during childhood was a lot of work. In the beginning, we would weigh Cruz's food, we would log it, what he ate on an Excel spreadsheet, weighing it before he ate, weighing what was left after he ate. Once Cruz started eating solid foods, I was always having to think about meals, prepare them, weigh them, document his feed. Cruz's favorite food I remember was avocado rolls. He started eating these when he was like 1 or 1.5 years old and still eats them today. I would send them in his lunch bag to school for years, making the rice fresh every morning he took them. Cruz was developing normally, and low oxygen levels at birth did not affect his development at all, thankfully. So, as Cruz started preparing to attend kindergarten, we were looking for alternative ways to manage his diet. We wanted to keep him on diet, of course. However, we felt like it was controlling us. We didn't want Cruz to feel different from his peers. We knew that he would be eating different foods from them almost always, but how could we normalize it for him? So, as we learned, we found that families managing PKU in other countries often allowed fruits and vegetables freely for their PKUer, while weighing and tracking all the other foods. After discussing this with our clinic, we decided to try this approach. Carefully, of course, with the understanding that if his levels rose above the safe range, which was over 6 milligrams per deciliter, we would reassess and return to a more traditional American method. So over time, we stopped weighing his food, we stopped logging his foods, and instead, we just communicated about it as a family on a daily basis. What Cruz ate, roughly how much protein he had, how much fee, and it helped us feel more present in life rather than constantly, trying to control it. We just worked with it. So every year he was in school, I would go in, I would talk to the teachers in his class and explain his condition to them. You know, I didn't want it to be something that was hidden or looked down upon, but instead understood and supported by myself and our family, his friends and teachers. As he moved into middle school, I would send an email to all of his teachers and the school nurse just to make sure they were aware of his condition. He would always bring his own lunch, and we would bring his PKU formula to school. He would fill that Camelback bottle with some water, and his formula would be separated into a formula container. Since being in kindergarten, he was able to mix those shakes on his own. He would, I don't know, have normally probably 2 or 3 during the school day, and he would just bring them in his backpack every day. As he moved into high school, he didn't want to keep bringing the PKU formula to school, though. It wasn't convenient, it wasn't comfortable for him anymore. And so this was kind of the beginning of a downward trend, and he wanted more food. He wanted more freedom with his diet. So that's where we were.
Okay. So Cruz, tell us a little bit, what do you remember about growing up with PKU? And how did it affect your day-to-day life as a kid and an adolescent?
Yeah, I mean, growing up with PKUs and for the week, it definitely took a ton of time and effort. Luckily, I had the right support group, though. I was surrounded with a lot of good friends and honestly, even better parents. Without my parents teaching me the importance of being content with, who I was, I would have never been able to make it this far. On the daily, I would go to school and would be different than others, and I came to understand that I didn't need it. I didn't need to really let it affect me. I was different from others growing up, and when they would ask what I was doing when I started to make my protein shake, sometimes I would say I have PKU and need extra protein, but most of the time I'd have a little fun with it. I would say it's like fairy dust sometimes, or even powdered sugar maybe, and they would always be left wondering. But all jokes aside, I had to take care of myself for sure and understand that this is serious and things can go south quickly if I don't pay attention, which is why my parents played such an important role in things, I think. And I'm proud to say my day-to-day life wasn't really affected as much people would kind of think. And that's because I honestly tried not to let it affect me, whether it was taking 8 protein shakes a day or one when I wake up, 3 when I'm at school, one right before hockey practice, and 2 before I go to bed, or it was putting them in the dishwasher before bed. I managed everything. And I managed because it was hardwired into my brain to be able to manage that. And that's because I had the best support group that I could ever ask for, like I mentioned earlier. And as I became older in my adolescence, I did start to experience symptoms of high Phe levels, including brain fog, feeling of insecurity, and being withdrawn a little bit. I also started to have challenges in school with my grades.
Okay. Can you all share kind of what sparked the conversation with your healthcare team about PALYNZIQ and what questions or hopes you each had when it was introduced as a treatment option?
Sure. Before Cruz was born, I was a yoga teacher. Is this the right area? Yeah, okay. Um, and with Cruz's diagnosis, I decreased my teaching engagement significantly and eventually stopped during COVID. We decided that I'd go back to work when Cruz was 15, and my new job required me to work like 60 to 70 hours a week, and it was located like 45 minutes from our home. So my ability to cook for him was significantly decreased. Cruz was also experiencing newfound freedom in high school with his friends driving and going out to eat. He tried to eat low protein diet as a young teenager while going out. However, the amount of food he wanted to consume was greater than it was in the past. He was growing fast. He was playing hockey in Minnesota at an elite level, and he was also playing varsity golf. He wanted and needed to consume more food in order to sustain an elite athlete's ability to perform. And, Cruz began eating more food, and his food choices were not always totally on diet either. He would not eat meat. However, he was consuming, cheese and bread and increase that over time. So during the course of a year, his level crept up to 14 milligrams per deciliter at the highest point. And we tried to have conversations with Cruz about our concerns. However, Cruz said he just needed more food that would make him feel full. And so that's when I reached out to Cruz's doctor and we had a Zoom call with his team. I told his team, what was happening. I told him that we had to find an alternative because, I was no longer able to cook as much or control Cruz's food intake. Cruz's level was scaring me. And after all the years of hard work, we had to find a way to lower his fee. Our clinic team told us about PALYNZIQ. They mentioned the side effects, including like the swelling at the injection site, the joint pain, and the risk of anaphylaxis. And, Cruz had been on sapropterin, which is also Kuvan, since he was 5 years old. And that was great at the time, and it allowed for, a slightly more liberal diet or portion food choice intake. However, it really wasn't that much more protein considering, he was now standing at 6 feet tall and almost always hungry. So after discussing, the possible side effects and the possibility of lowering Phe and what that might mean to Cruz, we decided, to try it. So when our insurance company finally approved PALYNZIQ for Cruz, we couldn't believe it. We were so excited, and Cruz has always wished to lower his Phe levels enough so he could eat what his friends eat. That was always going to be his, this PALYNZIQ was going to be his opportunity. And our hope was for Cruz's wish to come true. We wanted to see him happy, healthy, and thriving with his PKU.
Yeah, and to follow that up, the first conversation we had about it was with the doctor and clinic team over Zoom. And at first, I didn't think much of it. I was never thinking something like this was honestly ever going to be possible. So I honestly just brushed it off. It quite honestly seemed, yeah, it didn't seem real. Then what I vividly remember is the next day, I was laying on the hammocks we have at our house in Minnesota, and my mom walks outside and says it was going to be a possibility that I might be able to lower my Phe levels enough to have more natural protein at some point. And at the time, I was only able to eat 12 to 15 grams of protein per day, but it was not enough. And I was always hungry, like my mom said, I was a growing boy, but I didn't even know what to think of it at first. Being able to have protein seemed like something impossible for the longest time because my Phe levels were already high. Uh, Immediately, what worried me the most was having to inject myself. I was never a fan of needles. I don't know anybody that is a fan of needles, but when it came time to talking about whether or not I was going to give it a go in my head, the benefits definitely outweighed the risks. Was I content without eating protein? Yeah. But I remember thinking how much it would make my life easier. Taking every opportunity available has always been one of my key things in life, and taking Palynziq was definitely an opportunity I wasn't willing to pass up. Immediately, my head went, well, how long is it going to take for me to be able to have more protein? So we asked, and the answer wasn't very helpful. I believe the answer was 2 months to 5 years. And then the next question we thought of was the side effects. The one that caught my eye was definitely the anaphylaxis and having to carry an EpiPen. But other than that, I wasn't too worried. I knew I was strong, and Palynziq was definitely not going to be an opportunity that I was going to pass up. This was my decision, but obviously your guys's might be different.
Stacia, what was it like supporting Cruz after he decided to start PALYNZIQ, including any monitoring, adjustments, or challenges along the way?
Sure. We were all very excited and hopeful for Cruz to start PALYNZIQ. On the day we started, I remember Cruz and I traveled down to the clinic for the first couple of doses so that they could administer and monitor him. After that, we had a BioMarin clinical coordinator named Betsy, who was absolutely fantastic, come to our home to teach us and Cruz, how PALYNZIQ worked its potential side effects, the REMS program, and how to administer the injections. She was patient, thorough, thoughtful with her time and energy. I remember she waited for over an hour for Cruz to finally build up the courage to administer his first injection. And we decided early on that I would not be the one to administer his injections. If he wanted to be on Palynziq, he would have to do it. And honestly, it wasn't that I didn't want to do it for him. I just didn't want him to be dependent on me to do it. So at this point, I was still always the one that was taking blood samples to send in for his levels. So finally we were off and running. We were so excited. And we began the titration period of the injections. Cruz went through, many different side effects. The first was being site reactions. Sometimes they were mild, sometimes they were more severe. And occasionally the site reactions would turn red and would swell. It definitely was a reality check for us, an awakening for all of us that the journey ahead, it was not going to be super smooth. So, Cruz was taking an antihistamine to assist with our allergic reactions. About 3 months after his first injection, Cruz was starting to experience some pretty intense, allergic reactions. He was feeling joint pain, and I remember I would communicate with a BioMarin clinical coordinator and the clinic team on a regular basis about managing the side effects, and suggested means for relief. The BioMarin clinical coordinator occasionally would come and see us at home whenever Cruz requested her help. When Cruz began having joint pain, I would alternate between making ice packs for his joints and putting heating pads on the areas that hurt. There was one time I remember there were 6 different joints that were all causing him pain at the same time. And it's when he briefly questioned his plan. I also recall there were 2 days he stayed home from school because he could barely move. He was only getting up to go to the bathroom. The pain was, intense, And the worst was when he was doing hockey captain's practice to prepare for tryouts. So after telling the BioMarin clinical coordinator our concerns, and working with our clinic team, we decreased the dose temporarily while he took part in tryouts, and it worked. He made the JV team his junior year and was part of the first line of defense. Yeah, the season was sometimes challenging, while he was trying to balance his PKU requirements and his team's requirements at the same time. But in the end, they had a successful season. So over the next year, Cruz would occasionally have, injection site reactions as well as joint pain, but it was much less severe. Golf season brought big news as he was named one of the captains on the varsity team his junior year, and he would go on to qualify as an individual player at the state golf tournament. Cruz's senior year, he would play varsity hockey with his school, making it state for the 3rd year in a row. It would be during this time, I remember, about 1.5 years into treatment with Palynziq and right before going to state that Cruz's levels would take a significant and lasting drop. At this time, his Phe levels were also low enough to start increasing his protein and eating meat. It was different for him. Holding a knife to cut meat was new. The taste of various foods and meats was new. His hockey team landed in 3rd place at state in the state of hockey. So that was a huge accomplishment with all of his challenges. In golf season, it felt like a breeze with all his newfound freedom, not having to carry around water bottles for the 8 shakes he would have on a daily basis, and to be able to eat at restaurants with his friends, and it just made it so much easier. Really did.
Okay. Well, thank you for sharing that. Now, Cruz, we'd love to hear from your perspective. What was the experience like starting Palynziq for you, and how did you adjust over time?
Yeah, I'll be honest. As I began PALYNZIQ, it was nowhere near as easy as I thought it was going to be. The first couple of weeks, I had to go to my clinic. It was only once a week for those first 2 weeks. The first two injections were 2.5 milligrams and injected into me by the nurse. The first in my leg, and then the second in my stomach. I only remember this because the nurses were talking about how it will be injected into the fat and it should only sting a little bit. Well, that's how I felt for the first injection in my leg. But the one in my stomach the next week, that was when I knew this was going to be a little harder than I thought. The stomach is challenging for me, so I tend to prefer the other injection sites. The third injection was done by myself with the BioMarin clinical coordinator in the room, who was a huge help during the early stages of Palynziq. And I have no idea how long I sat there with the needle hovering over my leg, but it was a very, very long time. She kept saying, just pretend you're throwing a dart at a dartboard. And I think that's what kind of got me through it. And yeah, I eventually injected myself. But I was sitting there for a while and I felt bad that the BioMarin clinical coordinator had to sit there and watch me try to do it. It was awful. From there, it kept getting easier though, as we ramped up how many times I would inject myself a week. At the beginning, it was once a week, then twice, then every other day, all the way to the point I'm at now, where I am on daily injections. Now, let's move on to the side effects. Earlier, I said the only one I was worried about was anaphylaxis, and fortunately, I never experienced that. However, working through several of the other side effects was tough, whether it was swelling at the injection site to the point where it was hard to walk, or joint pain that made it impossible to walk. The first month was not easy at all. Each weekend of the month I started was a different wave of side effects, and honestly, it was really hard on me. It was hard to work at the golf course I worked at, um, hard to be on the lake with my friends, and I guess even hard to drive at times. But for me, after weighing the side effects with the potential benefits, I knew I couldn't pass this opportunity up. The opportunity being Palynziq. After about a month of harsh side effects and some help from steroids that my doctor prescribed for my joint pain, another month of more subtle things, my side effects resolved. Over the course of my first year on treatment, I was gradually able to eat more foods and natural protein, including some foods I had never been able to try before. When we started seeing a noticeable difference in my Phe levels, I started feeling a lot better. And after about a year and a half of taking Palynziq, my clinic said I could eat pretty much whatever food that caught my eye. Some of the foods I liked that I tried first included seafood. I love shrimp, love crab legs, chicken, eggs, bacon, and I absolutely love the Butterburger at Culver's.
Okay. So just one more question for you all. So how has lower Phe levels kind of influenced your daily life today? And how has it changed the way you think about managing PKU as a family and as a teen looking forward to the future?
Yeah, so not only has lower Phe levels allowed me to go from 12 to 15 grams of protein per day to having whatever food I want at this point, and I feel like it's easier to focus on everyday tasks. With higher Phe levels, I felt like there was always a ceiling on what I could kind of accomplish. There was always something that I couldn't do. Couldn't eat this food or couldn't focus on that exam. And therefore, I'm genuinely so grateful that I stuck with Palynziq. Through the ups and downs every injection brought into my life, I'm happy to say it was all worth it for me. I almost think it's a little bit awesome that I can tell people that I have to give myself shots every day. Because everybody always says, no way, or I hate shots, I could never. And my response to that is always different. But I usually say something like, yeah, I got used to it over time, but definitely worth it for me to be able to have protein. The best part is when people at the University of Tennessee ask what injections are sitting on my desk. And I always use this opportunity to have a little fun and make something up. The same as I did when I was making my protein shakes. Today, my lower Phe levels give me a sense of freedom from my PKU. PKU has taught me to be disciplined more than anybody knows. I have learned more from having PKU than anybody can possibly imagine. And I'm honestly proud to say I have PKU. It should never be thought of as a disability. It should be thought of as a superpower almost because of all the things you can learn from having such a big responsibility as such a young kid. I look forward to teaching people with PKU. I look forward to teaching people with PKU what they can accomplish, especially with the help of Palynziq. And I said it before and I'll say it again, I am honestly proud to have PKU.
You know, Cruz having consistently lower Phe levels and unrestricted diet has changed our lives. You know, the weight of trying to control Cruz's protein intake on a daily basis was eliminated. For me, it felt like the weight on my shoulders that I had been carrying since Cruz was born was gone. You know, I mean, sure, we had to slowly change his diet to a higher protein diet when Palynziq started working and slowly decrease his PKU formula intake, but it was happening, and any movement to increase the amount of food that Cruz could consume was a huge win. Within a few months, Cruz's Phe levels had dropped and he was eating what he chose and had stopped drinking his PKU formula. Because of this, he was confident to go to school in Tennessee, you know, and that's where he wanted to go, you know, and he could do this now. So he truly believes that his lower Phe levels and changes to his diet restrictions gave him the freedom to go to college out of state and manage his PKU. I have always taught Cruz to be grateful, even when his diagnosis felt heavy and hard. Now we are seriously forever grateful for the science and the technology that went into creating this medication.
Thank you. Thank you all so much for sharing your story and your experience. A lot to learn, so thank y'all. Kelsey, are there any more questions?
Yes, we did get one question. Someone asked, Cruz, what age did you start the injections?
Yeah, so I think I started the injections at what
16.
it was 16 and a half. Yeah.
Okay. I think that's the only question we have so far. But thank you all so much for sharing your story. It's really insightful to hear all of that.
Of course.
Well, I know we've gone just a little bit over time, but I think we had just one more slide to pop up. But we just, the NPKUA want to make sure that you know what resources are available. We have our mentor program, which is a peer-to-peer mentor program. And I think it's really important to make sure everyone knows that our mentor program is open to those 14 and older. With the consent of your parents. So I would really encourage, if there are teens out there who are looking for some support, that is available. We also have our monthly community calls, and those are led by our Director of Community Engagement, Sarah Gallagher. And it's different cohorts that you can see here on the screen. You can learn about those each month on our social media, as well as our e-newsletter. And lastly, I think I did see a question that came through about if this was being recorded. It is. So this will be available in a few days on our YouTube channel, along with the rest of our PK University webinars. So please, go back and watch and learn. But as we close out tonight, just again, thank you for joining us during PKU Awareness Month. And, on behalf of NPKUA and the BioMarin team, we would like just to personally thank all of our speakers for being here this evening and for each of you for attending and participating. So with that, we will say good night and hope you have a good rest of May and PKU Awareness Month.